Hello everybody. Today's video is about the cognitive effects of long COVID. Just before jumping into the video, just want to remind everyone that nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And also, if at some point you wouldn't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So I was listening to a webinar earlier today, and it was really interesting. It was put on by this doctor. He's a MD, PhD, so very, very smart cookie from Wichita, Kansas, if memory serves. And he was presenting some research that he kind of put together, or some kind of a compilation of research. He didn't do the research himself, but had put together this presentation summarizing some research, as MD, PhDs do, and was talking about the cognitive impacts of long COVID. So, we've all heard about long COVID now. It's been in the news, and I'm sure probably anyone listening probably knows someone who's been affected with long-term symptoms from COVID. But what was really interesting and quite frankly unsettling, not good to hear, was that evidently, based on what he was presenting, there have been growing number of studies looking at the effects on people's brains after they've had long COVID. And what he was basically, he kind of like summarized it all down, showing pictures of the, MRIs and this and that. And at the end of the day, the punchline was that it seems that the effects of long COVID essentially cause an acceleration of cognitive decline, or a brain decline of, loss of brain tissue, loss of brain matter. He showed an example of, this brain of someone where he said, this person, if they were, say, 65, and if it would be anticipated that their brain would, say they were, on the road to having some, brain atrophy, starting to have some cognitive decline, like say by the time they were 70, well, that same patient with long COVID, would have the same amount of brain decline by, say, the time they were 66, which, 4 years of cognitive decline, that's a pretty big acceleration. He was also presenting some data on individuals with post-COVID showing reductions in their some of their cognitive function tests, like with like memory and aptitude tests and things like that. And what was, again, interesting yet unsettling was that this was done in really young folks, like folks that were in their 20s. And so I just thought I would post this video because I know that folks who are drawn to my videos are typically folks who are dealing with complex chronic health issues. A growing number of folks out there with, coming to find doctors with, long COVID symptoms and whatnot. And so I think that with folks who have a history of long COVID, and let's say they've hopefully recovered by now, it would be worthwhile, I think, to, talk to their doctor, talk to their healthcare provider or providers about just, maybe talking about these research findings, saying like, what kind of checks are we going to do to make sure that my brain's looking okay? Probably not going to get, an MRI, especially not a pre and post MRI, because most of us don't have, pre MRIs of our brains, so there'd be no comparison to be made. But, maybe just checking in on, things that are important for brain health, like antioxidant status. A test that we do here at our clinic is QEEG brain mapping. Posted about that in some of my other videos before, but taking a look to see, is there any signs suggesting that there might be some, cognitive impairment, that there might be some signs of, potential neuroinflammation, some potential neurodegeneration, taking a look at some objective metric like that. If there aren't tests available, maybe just talking to one's clinician about saying like, I had long COVID, want to make sure my brainium's, nice and healthy, want to keep it that way. Maybe doing a little trial run, or doing a little brain boosting protocol with some antioxidants like, glutathione or methylene blue, or some phospholipids like phosphatidylcholine. I really like the product from the company Body Bio, which is Body Bio PC. I have no financial interest in that company. That's just the product that seems to have the best price point. It's expensive, but it's, of all the other really good phospholipids out there, it's got the best price point that I've been able to find, at least. And it's, a very good product in my opinion. Good old mitochondrial support, because there's lots of mitochondria in the brain, really important for proper brain health and brain function. So again, just a little bit of a PSA video today, where if you or someone has a history of long COVID, then maybe just consider passing on that information, or asking their clinician to look into that a little bit, because I see what I see with my patients with long COVID, and I see them getting better, but just seeing some of these, follow-up brain analyses, like learning about this, it's like, I didn't know that this research had been done, so now I know. That's why I'm always learning new things, listening to webinars, watching webinars, going to conferences, all of that. It's lots of information out there, but I thought this one was really worth posting a video on. The one other little tidbit that this doctor mentioned, I'm sorry, I forget his name off the top of my head now, but he mentioned that evidently the lifespan of the spike protein, that infamous spike protein that we all heard about ad nauseum in the news and medical settings for clinicians and whatnot that might be listening. The spike protein evidently has a lifespan of around 900 days in the body, which I had no idea about that. And I thought, when I first heard that, I was like, that sounds implausible. How would that happen? Like, how can anything survive for that long in the body that's not supposed to be there? But evidently, the folding structure of the protein is such that it's really, really challenging for our proteolytic enzymes to break it down. And I knew that the spike protein was resilient; it would stick around, but I did not realize that it had such a long lifespan. So evidently, it's very hard to break down. He was also saying that they've done some studies where in animal studies, administered a 50% digested spike protein, and it still had notable inflammatory effects. So it's not like, oh, well, it's going to kick around for 900 days, but if they're starting to get whittled down, maybe once you just like kind of snip the end off of it, it's not toxic anymore or not pro-inflammatory. It's like, well, apparently at least even at 50% of its original size and structure, it's something that can still cause a lot of inflammation. So anyways, just a little fun tidbit. Again, interesting stuff, also disheartening stuff to hear, but probably better to know this information, and so we can be better equipped to know what we're dealing with, as opposed to not knowing these things. So better to know than not know. If anybody has any comments or questions on this topic, please post in the comment section below, and I hope that this was of interest.